Hi, welcome to Life on the Couch. I'm Adam Bagley.
I'm Libby Watson.
And I'm Ken Johnson.
And Life on the Couch explores topics related to counseling, mental health, spiritual health, everyday issues, and helpful resources. And you can find a little bit more about us and what we do and some of those resources at lifeonthecouch.org. So today's a little different. I know we normally do kind of the 3-topic thing and go back and forth and banter, but today we've kind of explored an article for a while, and it's caused maybe some different feelings and different thoughts, and so we thought today maybe we would just focus on the one article and give some time to kind of talk a little bit and dialogue more about maybe some of the implications from what this is kind of concluding. So just to kind of introduce the article first, and then maybe just define a little bit about some terms before we get into exploring the article. So the article's in Newsweek, and the cover's kind of interesting. It's about antidepressants, and the top says antidepressants don't work, but when you turn the magazine over, it says antidepressants do work. But Libby pointed out that it's interesting how the top cover is antidepressants don't work, and I think maybe we're trying to sell some magazines here too.
Yeah, and it's in white, it's in gray that say they do work, and it's down there like the label could even be covering that up.
So what this article talks about, and the guy's name is Irving Kirsch, and he's looking at the effectiveness of antidepressants on depression. Mm-hmm. And so before we even get into this article, let's talk a little bit about what depression is.
Yeah.
Okay. Well, we use the Diagnostic Manual of Mental Disorders, DSM, and the latest is 4. The criteria for a major depressive episode is how we kind of help define depression is this episode. 5 or more of the following symptoms. Okay, and it needs to be lasting for at least 2 weeks. Mm-hmm. All right. The first one, which is one of the essential ones that you have to have, is depressed mood most of the day. Okay. Yes. Nearly every day, just having that depressed mood. All right. The second one that's essential is either 1 or 2. This one is diminished interest and pleasure of activities that you normally have. You normally enjoy certain activities, but right now you don't enjoy them. Mm-hmm. Almost all the activities. Nearly every day. The third one is significant weight loss or weight gain. Okay, so you see both with depression, either eating too much or also not eating at all.
So it's not just the mental aspects of depression, but there are some physical aspects that go along with it as well. Mm-hmm.
The other one is insomnia or hypersomnia.
Either you sleep too little or sleep too much.
Right.
Okay.
Nearly every day. Then you have psychomotor agitation or retardation. So you're moving, or you're agitated, you're moving around, you're pacing, you're tapping, or you might be retardation, which you are just still. Mm-hmm. All right. Fatigue or loss of energy. Okay, that's self-explanatory. Feelings of worthlessness or excessive or inappropriate guilt. So you have a lot of guilty feelings. You feel worthless. We see a lot of that in depression. Mm-hmm. Diminished ability to think or concentrate. Okay, so you can't decide. You can't make decisions. You're not thinking clearly. You can't concentrate very well. And then recurrent thoughts of death. All right.
And so that's for major depressive episode.
That's a major depressive episode, and that's how we diagnose depression. And you have to have at least 5 of these.
Okay. Mm-hmm. And I think before we even start this article, I go ahead and throw this out there that we are not advocating that anyone stop taking medication. If you are on medication, this is not a push to stop doing that. Mm-hmm. So if any adjustment or any stopping of medication, you need to go talk to your primary care physician. Mm-hmm. So definitely say that.
With any
before.
medications, you need to be with your doctor on that.
Yeah.
Mm-hmm.
There's a certain amount of tapering off you have to do on most antidepressants. antidepressants.
Sure. I mean, there can be some really ill effects if you just cold turkey stop taking medication.
It can actually make you worse.
Yeah.
So.
Sure. All right.
And so when you think about depression, I think you also have to consider not only what is depression, but what causes depression. You know, sometimes those feelings of selflessness, worthlessness, you know, the whole feeling of loss of interest in life, some of those things are often brought about by activities that are going on in their life, circumstances. You know, and sometimes I refer to them as circumstantial depressions. The death of a loved one, loss of a job, some traumatic event that happens that causes you to be depressed. Now, all of us have had those situations where we feel depressed for a period of time, but most of us can come out of those on our own. You know, we talk to friends, you know, sometimes just waking up the next day, we feel better. And so there are situations that may cause us to feel depressed, but we can usually get through them on our own, and we're fine after a few days or a week or two. But there are also depressions that are caused not by the circumstances, but by a real chemical imbalance within the body due to many different situations that may cause one to feel depressed that are not related to activities, but just the chemical things that are going on. And so those things also can cause depressions. So when we're looking at, you know, what is depression, understanding that there are different reasons why one might be depressed is also important as we begin to define some of these things.
And different levels
Yes.
of depression. I mean, what Libby was reading was from a major depressive episode. And I think that might be, I guess, a good transition into what this study or what his findings are stating. Basically, I guess to sum it up, and you know the article's a couple pages long, but Kirsch's looking at the effectiveness of medication on depression, specifically looking at mild to moderate depression. When it comes to major depression, drugs have been shown, and it states in the article, research has shown that antidepressants help about 75% of people with depression. So he's looking at some of these studies, and he's gone back from the FDA, and he's pulled some of these studies that weren't published, and he's looking at these findings. And what Kirsch is suggesting is that there may be a possibility that the effectiveness of the medication may not be coming from the medication, but the prescribed thinking or the mental thought of, I'm taking something that's going to make me better, therefore I get better.
Before we go into that specifically, though, let's go back one step and just discuss how is depression generally treated.
Okay. Yeah.
Because this is specifically about the use of antidepressants, but I think it's good for our listeners to understand, well, how is depression generally treated? So let's talk a little bit about that. Libby, how are ways that we treat depression for counseling or just in general?
Well, I believe when you are feeling depressed, you talk to friends like you're saying,
Yes.
but if you don't feel like you can get help out of that and you're still feeling that way, you need to go see a counselor.
What is the advantage of a counselor? What does a counselor do?
Well, a counselor will help you identify reasons why you're depressed, also identify how from mild to severe depression, so to see what kind of help you need.
And certainly I think what we do in counseling is to help that individual look at options, look at ways of working through their depression and find hope and find things that they can do that will help them to get through that. So certainly talk therapy, the counseling aspect is going to be one way that we treat depression. Another way that we treat depression, I think, is with medication. And medication has shown over the past to be effective and sometimes not to be effective. And I think that's where this article is coming in, is it's talking about, well, how effective is antidepressants in treating depression? And I think there are multi-levels to not only depression, but how we treat it and what seems to be effective. Not everyone is going to get the same effect as everybody else. There'll be differences in that. So when we're looking at it, what are some of the arguments then for or